The aim of this study was to investigate the long-term effect on anal continence after one sphincter injury, as well as the additive effect of a repeat sphincter injury. The aim was also to study the effect of sphincter injury on other pelvic floor disorders. Women were recruited from a national randomly selected cohort of 15,000 per woman, delivered 92 to 98. And women with 2 OASIS consists of a total cohort of almost 500 women, delivered 87 to 2,000. All were invited to a questionnaire survey regarding current pelvic floor disorders in 2015. The response rate was 67%, and almost 7,000 women with no OAC were recruited, 350 women with 1 OAC, and 320 women with 2 OACs. In blue, we see women with no OAC, red, women with 1 OAC, and green, 2 OACs. And the mean follow-up time since first delivery were similar in all 3 groups. The prevalence of fecal incontinence doubled from 12% in women without sphincter injury to 24% after 1 sphincter injury, and tripled up to 36% after a repeat sphincter injury. The severity of incontinence were measured by a number of parameters. The subjective impact of fecal as well as anal incontinence, the need to wear a pad, the need to make lifestyle alterations, and by Wexner score. The Wexner score cross-tabulates frequencies with symptoms of anal incontinence, and the sum ranges from 0 to 20. And all parameters of fecal and anal incontinence increased consistently with every sphincter injury compared to women without sphincter injury. And the strong association between 2 sphincter injuries and fecal incontinence was not seen for any other pelvic floor disorder. And 20 years after childbirth, twice as many women with 1 OAC had fecal incontinence compared to women without OAC. And after a repeat sphincter injury, every 3rd woman had fecal incontinence. In the long term, women with OAC more often needed to wear a pad and had to make lifestyle alterations to cope with their problems. Thank you very much for your attention.
Are there any questions? I have a question. 67% response rate. Wow, that is wonderful. What do you attribute this to? Was it only a postal return, or did you have a web-based site as well?
Yeah, we had a web-based and postal response. And the web-based responses was about 57% of all responders.
Good, thank you. Any other questions? Oh, yes.
Hi, Denise Goldman from Södersjukhuset, Stockholm. I wonder, did you do any subgroup analysis of partial versus total OAC?
No, we didn't. We all OACs are analyzed together. No regard taken to the severity.
Thank you.
Good morning. Thank you very much for your presentation. Impressive study. Have you been able to discuss your results with the obstetricians and midwives in your country? Because we are talking to people who are interested in this condition, but we've done some of these studies and we've encountered that it's very difficult to get in touch with the people who do the obstetrics.
Yes, we have experienced often the same, but since we're talking about the women with most problems are those with a repeat sphincter injury, and my experience is that obstetrics and midwives they think that, okay, if you have had one sphincter injury, then okay, then you can go on to have a cesarean for your next delivery. So that, I think, is that's not be such a big discussion, but discussion is about how to prevent the sphincter injury.
Just a comment more than a question on the previous question. Indeed, the clinicians are very interested to have an answer, and to are spending careers and lives to get the answer as to what's the optimal mode of delivery, and also see only here in this conference is the one side of the coin, which is the vaginal delivery, but we never look at the risk factors of the alternative, which is the cesarean section. So the counseling we do in the UK is that yes, there's about 8 to 9% risk of a repeat OAC in the vaginal birth with a previous OAC, which means that there is a 90 or more % risk of non-OAC in a repeat vaginal delivery. And I think it's an important take-home message to keep in mind that always we have to be balanced in our counseling. Thank you.
It's still the woman herself who should have to make the decision for her, what risks she are willing to take.
Okay. My name is Eva Westling. I work in Stockholm. Since about 5 years, there's a national register for women before delivery, a month after, and a year after, to see how they are before delivery and how you can find after injuries. So try to select and try to advise how to prevent this. Do you know about that? Do you know about it?
Yes, the graviditetsregistret.
Yeah.
Is it? Yeah.
So it's quite interesting that you try to follow the women before delivery and separate times after. So it's a national register.
Mm-hmm.
Thank you very much. We'll move on to the next paper.